This is ultrasound of the pancreas. We're not trying to get you to read a ultrasound of the pancreas and to argue with the radiologist. We're trying to get you to recognize normal anatomy. We'll start by showing you some ultrasounds from my actual patients, labeling them, and then leaving enough room at the end of each image so that you can actually stop, look at the video without the labels, and try to quiz yourself to see if you can read these ultrasound images. Here we have an image of not only of the portal vein and the splenic vein, but of the pancreas proper. In this image, the pancreas can be clearly seen in the center. The body is labeled. The portal vein sits below. Here, the body and head of the pancreas are both labeled. The common bile duct is seen here. Normally, it's less than 0.8 centimeters. This is an advanced study and difficult to see. Here, the head and tail of the pancreas are clearly delineated. The head and tail wrap around, in this case, the portal vein. You can see the lobulations within the tail of the pancreas very clearly and the fatty nature. A portion of the splenic vein is seen as well as the portal vein. Here, all of the images are labeled. The vertebral body, along with the kidney, the aorta, the inferior vena cava, and the left renal vein. Here, the vertebral body and the aorta are clearly seen, along with the left kidney. The head of the pancreas, the aorta, the inferior vena cava, and the duodenum. The liver is really all that can really be clearly delineated in this picture. The portal vein, along with the liver, is seen along with the vertebral body posterior. Body of the pancreas, the splenic vein, the inferior vena cava, and the aorta can all be clearly seen here. They are all labeled in this image. In this image, you can see the body of the pancreas with the lobulations of the tail. You cannot clearly see the duodenum in these images. Portal vein is clearly seen wrapped around and in the center of the pancreas. Here, the aorta is most clearly seen. Here we see the inferior vena cava along with the aorta, portal vein, splenic vein, and even the spleen is well seen in this image. The pancreas of the pancreas body is seen clearly here. These images on VH dissector will help reorient you to the anatomy. In this image, the inferior vena cava, the head of the pancreas were labeled. Here, the tail of the pancreas is seen in purple. Remember, the pancreas is a retroperitoneal organ. Here, the retroperitoneal fat is seen, along with the two kidneys and the retroperitoneum. The head of the pancreas is seen in purple. The left renal vein is seen clearly crossing over the aorta, which is in red. The superior mesenteric vein touches the head of the pancreas in this image. The superior mesenteric artery, superior mesenteric vein, and head of the pancreas are all labeled. Note how the superior mesenteric artery comes off the aorta and the relative small caliber of the aorta in this image. Obviously, you'll need to replay this video several times to see the anatomy and to learn it. But in combination with understanding the transverse section seen here in the VH dissector images, you'll be able to more readily correlate those with the ultrasound images. In the next view coming up, we clearly see the splenic artery coursing through the posterior aspect of the tail of the pancreas. Damage to the pancreas, i.e. chronic pancreatitis, or even acute pancreatitis, can cause erosions into the splenic artery and patients can bleed to death. Here, the head of the pancreas, the inferior vena cava, and the splenic vein can all clearly be seen. the liver and spleen are also delineated. Patients who have cirrhosis of the liver or suffer from chronic pancreatitis can actually have damage to this portal system, causing portal hypertension. In this final image, none of it is labeled. This is for you to practice on. The spleen, liver, kidney, head of the pancreas, inferior vena cava, diaphragm, splenic vein, and the portal vein can all clearly be seen. The head of the pancreas is colored purple. Please replay this video multiple times and correlate this with the CT scan video to better understand ultrasound of the pancreas. Please understand that when making this video, the intent is very simple. We want you to recognize normal anatomy using cross-sectional radiographs or transverse images from VH dissector to correlate with the ultrasound images. This takes years to develop this skill, so don't feel bad if you can't look at the image right away and see anything more than what looks like a bunch of clouds in the sky. It takes time. In the next video, we'll focus on CT scan images of the pancreas, and we'll show some pancreatic pathology, since pancreatic pathology is more clearly seen with dynamic CT scanning of the pancreas. Just play and replay these videos until you can recognize the basics. One of the biggest mistakes a family physician makes is to simply read the radiologist's report without looking at the images. The more images you look at in your career, the better off you'll understand your patient and the patient's pathology and learn to read these radiographs better and better and better with time.